Welcome to My Psychedelic Roots, a podcast of conversations with people from a broad swath of lived experience to explore their psychedelic beginnings, or roots, what led them to start using psychedelics, what those early experiences were like, and how those roots have impacted their life's unfolding. My name is Amy Bartlett, and it is my hope that these stories, generously shared by my guests, offer perspective and insight into the lived reality of psychedelic experiencing. So whoever, wherever, or whenever you are, welcome. I'm glad you're here. In this episode, I'm in conversation with Dr. Monnica T. Williams, who to me is a supervisor, colleague, and friend who I've had the pleasure of learning from and collaborating with over the past 6 years. And so it was nice to be able to sit down together outside of the professional context and talk a bit about her personal journey towards psychedelics for healing, and how her relationship with these substances evolved into what has become an important part of her career unfolding. On a professional level, Monnica is a board-certified licensed clinical psychologist and a professor at the University of Ottawa in the School of Psychology, where she is their Canada Research Chair in Mental Health Disparities. She is also the clinical director of the Behavioral Wellness Clinics in Connecticut and Ottawa, where she provides supervision and training to clinicians for empirically supported treatments. Her research focuses on BIPOC mental health, culture, and psychopathology, and she has published over 200 scientific articles on these topics. Current projects include the treatment of racial trauma, improving cultural competence in the delivery of mental health care services, and addressing structural racism. Monnica is an accomplished researcher and clinician, and in our conversation together, we also get to explore her personal journey, including being exposed to some of the complex sides of substance use as a teen, going to university and starting in engineering, but then getting interested in psychology and mental health because of experiences with her family, and all eventually leading to her first personal encounter with psychedelic substances in a clinical setting. We talk about what she learned in that first journey and how her evolving dance with psychedelics has impacted not just her career path, but perhaps more importantly, her relationship to herself. It was lovely to have the opportunity to sit down together and wend our way through her unique story. And so, let's hear more about Monnica's psychedelic roots. Welcome, Monnica.
Thank you. It's great to be here.
Yeah, lovely to spend some time together. And so in our conversation today, we're going to be talking a little bit about your psychedelic unfolding. Before we get into hearing about that, I'm curious if there's anything that you feel would be important for people to know about you and your background and your life today before we start moving into the conversation together.
I'll just let you ask whatever questions you feel make sense in the context of what we discussed today, and we'll go from there. It's an open book. I'm happy to share whatever you like, whatever people will be interested to hear.
Cool. Well, I read a little bit about your background professionally in the introduction to this, so maybe we can jump into getting to know you a little bit and talking a little bit about your childhood. I'm curious, thinking back to your younger self before psychedelics, how would you describe your way of seeing the world, or what felt true to you then?
Well, that's a good question. It's kind of hard to, I guess, remember how I thought about things that long ago. I think, as a kid, you just sort of experience life as it comes.
It's true. And so did you have any relationship to wonder, or did you have a spiritual side to yourself when you were a child?
Well, I was raised Baptist. And so even from a small age, I went to Sunday school and went to services with my grandparents and then my parents sometimes. And so that was really my first spiritual experience or my initiation, into understanding God and, the universe of creation.
Yeah. What did little Monica think about the universe and about God and creation? Was it a safe space? Was it a space that felt confusing? Was it a space where you felt big or small?
Well, Uh, I think that's kinda hard to answer. Yeah. I mean, I think I always felt like, the world is large, the universe is even larger, and, we're just kind of little tiny microscopic pieces of dust on this still spinning marble on the edge of the galaxy.
And do you still believe that?
I do. But I feel we're more than just little pieces of dust because I feel like we're connected to all of it. We're all a piece of all of it. So, we're small and we're large.
Yes. Well put. Did you grow up in an environment where psychedelics were ever discussed, either positively or negatively?
No, there was really no discussion of psychedelics growing up. There was this whole category of stuff you should avoid, drugs writ large. This was something that was instilled in me at a young age that, that these weren't good. I mean, not even so much formal lectures from my parents, but just sort of, seeing the way they would talk about things like drugs and I grew up in the Nancy Reagan Just Say No era. So, I never really heard anything positive about drugs. So I didn't really have any desire to try them or any reason to think that there might be more to it or that there was any nuance in terms of differences between different drugs. It was just all just one big kind of negative thing.
Yeah. And so, was there a particular moment or conversation or experience that brought psychedelics into your awareness or perhaps distinguished them from that say no to drugs culture that you grew up in?
Well, I had a boyfriend in high school. We were together maybe 2 years. And he would sometimes try different substances. He also was a big fan of Pink Floyd. So, we listened to those albums together. And obviously, there's a lot of psychedelic influence there. So, maybe that was my first impression of psychedelics in terms of that music. But that being said, that my boyfriend, he wasn't really, he struggled a lot. He struggled with his own issues, family problems, depression. He didn't really, he dropped out of high school. He went back and got his GED later, but it didn't seem like the drugs were helping him, I would say.
Right.
So it to me was just maybe one more reason to stay away from drugs because, you know, it didn't seem like it did him much good.
Yes. Yeah. Obviously, eventually you did move into the psychedelic space. I'm wondering if that experience with having a boyfriend who struggled with mental health and also with drugs in any way impacted your career choices or the choices you made on your path towards working in and with psychedelics.
I would say not at that point. If anything, it was a deterrent. Mm.
So, what I'm hearing you say is that, you grow up in an era where psychedelics and drugs were a no-go, and you had a personal experience of having a partner who had experiences with drugs and sort of reinforced that this is not something that is very supportive of one's life path and unfolding and is not for me. And so I'm curious how you decided to move into the field of psychology and start to explore the mind, if not with substances.
Yeah, that's a good question because my relationship with that boyfriend ended when I went away to university. I went to MIT to study electrical engineering. So it was not psychology,
At all.
any stretch. Although, I did have an interest in psychology. I didn't know that it was psychology at the time, but I was already doing things like, I was part of the student committee for educational policy. We did surveys on quality of life on campus and things like that. After I finished school, I kind of felt like maybe engineering really wasn't for me, but I didn't have ideas about what else I might do right away. I graduated with one baby on one knee and
Mm.
9 months pregnant. So my second son was born literally the week after graduation.
Oh.
So I was a little busy with that. My husband was working at a research lab, in Boston, doing research on digital mammography. And that's actually how I got interested in mental health because he
Hmm.
had some mental health problems. Neither of us really understood when we were young, but as time went on, it got worse and worse. And, later diagnosed with bipolar disorder.
Mm.
So, so part of my motivation to understand, what was going on with him, got me involved in mental health organizations, and and he also had OCD, and we were living in Los Angeles at that time because he had gone on for his doctorate at UCLA. And I got involved with the International OCD Foundation, their
Hmm.
California branch. I said, like, "How can I help?" And they said, "Well, we need a website." And I was like, "Oh, I can do that." I was working at the computer science lab at the time, so that was pretty easy
Right.
for me at that time. So I made him a website, and they're like, "Oh, this is great. You wanna join our board?" I said, "Okay." So So I was on their board, and they had a hotline for people to call. This is back in the day where people had, like, beepers. So people called beeper, and then, like, you call them back, and it was like a crisis line. And so I would have a shift too. And I remember very vividly one call that I got from a woman with OCD. Her OCD was so bad that she was, like, literally stuck in the waiting room of her doctor's office. She just had an appointment. Her husband was waiting for her outside in the car, and she was stuck in the bathroom, and she was obsessing about maybe she accidentally put poison in the soap dish and didn't remember, and just was needing to check. And her husband was, like, saying, like, "If you don't come down here now, our marriage is over and I'm leaving you. I can't take this anymore." And I just remember, like, my heart going out to her, but having no idea what to say or what to do. And
Yes.
feeling like, "You know what? I think I could benefit from learning some psychology." And I took a psychology class. I was working at UCLA, so I could take the night classes, but pretty low cost. So
Nice.
So I took a couple of classes, and they were pretty easy compared to the engineering classes I'd done. So I was able to take a bunch of them pretty quickly, and I did pretty well. And then I was able to go to grad school. Mm.
That's amazing. And how was grad school for you? Did psychedelics enter the scene, or as you move back into academia and sort of a school environment, or was parenthood and partnership pretty consumptive
Yeah. So by the time I
curricular?
started grad school, I had 4 children, one in diapers.
Yes.
And actually, I had wanted to go to the University of Hawaii, but I didn't get in. I got on the waiting list, but I got a full scholarship at the University of Virginia. I had family out there, so I said, "Oh, okay, we'll go to Virginia."
Nice.
And my husband was ABD at that point, so I said, "Honey, it's time for us to leave. You need to, like, finish up what you're doing so I can start what I wanna do."
Yes.
And he got a job as a visiting professor at James Madison University
Mm.
while he was ABD, and I started a clinical psychology program at the University of Virginia studying OCD, which was my interest.
Yes.
And in fact, actually, even today, most of my publications are OCD. And so psychedelics were not like a part of that at all.
No. S So, you went back to grad school, you got your PhD in clinical
Mhm.
psychology,
No, I went in academic medicine, actually.
academic medicine.
So it was practice and research as part of a big research lab, and was also seeing patients in the clinic there. So
Mhm. How long did you work in practice or in academia before the psychedelic question started to enter your mind, either personally or academically?
yeah, so it was several years. I was in Pennsylvania for 4 years, and then moved to Louisville, Kentucky. And it was while I was there, well, I was trying to get, federal grants to study OCD and multicultural youth. And despite putting in many good grant proposals, none of them were getting funded. And the NIMH had just adopted what they call the RDocs, criteria, where they were really very interested in mechanisms, particularly biological mechanisms, and they were not interested in funding my study on multicultural youth with OCD. So it just wasn't going to happen. So I thought, maybe I need to pivot into something more fundable. So I was also interested in trauma. I was also interested in PTSD. So I thought maybe I would focus my research more heavily on that. Some of my work was fortunate to be featured in the New York Times Magazine, and someone from MAPS had seen the article. And this was while I was at the University of Louisville in Kentucky. And they reached out to me. It was Natalie Ginsburg, and said, "Hey, I'd love to connect one researcher to another." She sent me an email. I think I didn't even see it, and she sent me another email. I was like, "Hey, what's up?" She's like, "Can we talk? Can we chat? Can we talk?" And she told me about the work that MAPS was doing with PTSD, MDMA for PTSD, for treatment-resistant PTSD, and their challenges in getting a diverse sample for their studies, that they were finishing up phase 2 trials. They wanted to move into phase 3 trials. The FDA was going to be interested to know that the findings are generalizable to different, groups.
Mhm.
And
What was your initial impression having had this outreach from MAPS and hearing about MDMA for treating trauma? Did that seem interesting? Maybe a little crazy?
yeah, it seemed bizarre. I thought, "Oh my gosh, these people are doing some kind of weird pseudoscience. I want absolutely nothing to do with this. Please go away." That was my initial reaction.
Mhm. And what changed your mind?
Well, Natalie was persistent, and she said, "Well, she was telling me all the different things that they had done, and none of these things were convincing to me." And then she said, "And we've published some scientific research." And then I was like, "Oh, really?" And she said, "Yeah, yeah, I can send you the articles." I said, "Okay, I'll take a look at that." So I got the articles, and then I started reading them, and I was like, "Oh, wow, this is real research. They're like really doing research stuff." So
Mhm.
so then I so then I was like, "Okay, well, I'm open to hearing more," and they invited me to a training in South Carolina with the Mithoffers,
Yeah.
and we watched some videos of people who has very severe PTSD and the process of the therapy and then how they got better. And I kinda had in my mind from reading the articles that they were gonna be doing some kind of therapy, like prolonged exposure, and while the person was under the influence of MDMA, and maybe that would make it easier for them to do it. And I was really surprised to see people just laying down under a blanket with listening to music with eye shades. It's not any kind of therapy I'd ever seen before. And it's like they were just they were just getting better on their own. They weren't doing any prolonged exposure or anything. And I
Mhm.
was like, "Huh, wait till you look at that." You know? And I thought, wow. And then, you see them afterwards and you can just tell they look so different. Like the eyes are bright and they're talking about the future, and and that whole pall of trauma was just gone. And I thought to myself, that's what I want for my clients and for my community, because prolonged exposure is what I was trained in directly from Edna Foa. It's very effective, but it's a difficult treatment, which I have no problem, you know, giving a difficult treatment to people if that's what they need to get better. But then it was like, then now there's this other treatment that seems like it's working just as well, much more humane, and I felt like the prolonged exposure that I had been trained in, it was like Stone Age tools, and the MDMA therapy was like a sonic jet, and I thought, like, I want the sonic jet.
You wanted that sonic jet for your clients and to
Mhm.
better support their healing. When did that curiosity translate into your own experiencing and wanting that for yourself potentially as well?
Yeah, so, in my work with MAPS, when they set up phase 3 trials. There's a multi-site study, and at that point, I was moving from Kentucky to the University of Connecticut, and, and we had planned that I would have a site there that would focus on recruiting people of color for the study. And so as part of that, they had their own study. MAPS had a study of healthy volunteers where they would give MDMA to healthy volunteers in the same way that study participants would get it and look at a number of different outcomes. And this was one way that they were training the therapists in the study so that the therapists would know what it was like to have the MDMA. And so everybody and most of the people on my team went through that study. It was taking place in Boulder, and flew down to Boulder to have the MDMA under those circumstances. And so that was my first introduction to psychedelics, was as part of that study.
And so how did you feel about it? Were you nervous?
I was nervous. Actually, Michael Mithofer offered me to have MDMA when I was in South Carolina when I was first learning about it. And I was like, yeah, no thanks. Thanks, but no thanks. But then I thought about it a long time and I thought, well, gosh, is it not going to be a better chance to try something like this? Because, like, you're like literally, they were like a doctor and a nurse, and with medical grade MDMA. I mean, it's not
Mhm,
like getting it on the street or something. So I thought, well, that's probably the best opportunity I would have to try something like that
mhm,
and for it to be safe.
mhm.
So I eventually decided I would go ahead and try it.
And so was it in that sort of classic clinical setting in the sense that there were 2 people supporting you, eye shades, music? Yeah. So how was it
Yeah.
moving into that experience?
Yeah, it was exactly like that. I was a little nervous because, this was my first time having a psychedelic of any sort and, plus decades of programming that, this was dangerous, this was gonna melt holes in your brain. And then also as African American, having the whole fallout of the war on drugs in my community, is there like a cop hiding in a tree somewhere that's gonna see that I had MDMA and arrest me, right?
Yeah.
So
Yes. And so what kinds of things did you do or did the facilitators do to help you feel safe and to move into the experience? Do you remember taking the medicine or do you remember some of the preparations you did before taking it?
Yeah, yeah. I mean, for one, I had a fantastic guide. Her name's Marcella, and she'd been doing this a really long time, very experienced, very, very sweet woman. And so just her presence was very comforting. And then there was another person as well who was working with her. And so she made me feel very comfortable and safe. And yeah, and then I, just swallowed the pill and I was kind of sitting there talking. And then all of a sudden I was like, feeling a little dizzy. And they said, oh, well, why don't you lay down? And I'm like, yeah, that's a good idea. And then it started to kick in and then I had my first experience.
Yeah. And so what were some of the highlights of that experience for you? What did you learn or how did that unfold for you?
Yeah, it was really interesting because the very first thing that came into my mind was, I don't understand why this is illegal. This doesn't make any sense. That was the first thing, the first connection that my neurons started to make.
Interesting.
I know. And then I was shown, and then I realized, I think the medicine was kind of showing me how I had turned everything in my life into work. Even the things that were supposed to be fun, even the self-care things were just one more item on an endless checklist. And that I just spent my whole life just checking off things on this checklist. And and I was like, damn, I don't want my life to be that, you know?
That's quite a confrontation.
Yeah, and I remembered that my sister who lives in Germany, she's part of a sailing club, and she would go sailing every year on Lake Constance, which is a beautiful lake on the border of, Switzerland, Germany, and Austria, and she would invite me every year to go sailing with her, and every year I would say no because I couldn't fathom taking, like, 2 weeks off of work. That just didn't even register as something that I could do. But all of a sudden, I was like, I'm going to take her up on that offer. I'm going to go to Europe and we're going to go sailing and I'm going to take a vacation and I'm going to take a 2-week vacation. I'd never taken a 2-week vacation in my life. And, and I have to tell you, when I got to Europe and people were like, "Oh, how long are you here for?" And I was like, "I'm here for 2 weeks." And they're like, "That's it?" They had a whole 'nother concept of a vacation in Europe. They know they do it right there is what I have to say, but it is a big step for me,
Everything's relative. That's a big yeah, that's a huge step.
and I
Amazing.
had a great time. So,
Good.
that was one of the first insights that I had, and then other things we worked on were around my childhood. So, and a lot of that was Marcella bringing that up. We had some conversations about my inner child, and I realized I really didn't like my inner child at all. And, uh, and she said, "Why not?" And I didn't really know, but then I did know all of a sudden. It's like, because she was so vulnerable.
Yeah.
Mm, and, and that shifted a little bit for me because she challenged me. She's like, "Well, can you find some love in your heart for that child?" And I'm like, maybe a little bit, you know. And that's been a process, but that was the start of it.
Yeah. Those are 2 very big pieces,
Yeah.
both dismantling the doing, but also connecting in with the being, it sounds like, and that sort of
Yeah.
inner core self.
Yeah. So I
Wow.
would say those are a couple of the big things that came up for me.
Mhm. What was it like coming back to Earth after that first experience? Was it a smooth landing? Did it feel kind of overwhelming or confusing? How was that for you?
Yeah. Well, I think it was good, but it was challenging too because I was going straight from there to my daughter's wedding. And, weddings, I mean, they're happy, but also you bring all the family together and, there's always people that don't get along at these things and there was some drama and stuff and that was really difficult to have to deal with drama. Uh yeah.
In that open, tender, vulnerable state. Yeah.
Yeah. Yeah. And my ex got into a fight with my other daughter's boyfriend, and it was just very ugly. So I just had bought him a plane ticket for him to go home. It was kind of a rough week afterwards.
What would you have done differently coming out of that experience
Yeah, I
after that
mean,
first experience?
if I had kind of understood that whole integration thing, maybe I would have scheduled that experience to give myself a little more time before something big like that, where I would have had more downtime. Just take in and process everything.
Yeah. I know, Monica, you've done a lot of work since that first experience. You offer ketamine to clients in various places. I'm curious how those insights from that first experience, how are you still integrating them or how are they still showing up for you in your life?
Yeah, that's a good point. I mean, I think one of the things, is I'm very conscious about making sure that I have time for fun, for vacations, for self-care, trying to make the self-care less like a chore and more like care, you know? And, and I mentioned also, kind of the work on my inner child has been ongoing. And I feel like I've made a lot of progress in that area. It used to be like I didn't even like to look at pictures of myself as a child, as it just would bring up those feelings. And I feel like that started to loosen a bit. And then also, well, again, like I want to make these treatments available to as many people as possible, particularly people in my own community who are more traumatized and have less access. And so that's been the focus of my work really with psychedelics, access. and reducing, barriers to care, making sure that as these substances become legal and more available, that, and this was really one of the first things that I had asked the folks at MAPS. I said, look, I'm really not interested in doing work on something that's going to just end up being for affluent people, and they said, no, we really are interested in making sure that they're available for everyone. And that's was an important part of their mission. And that was important to me. And I really believed that was part of what they wanted to do, although the implementation of that has had its ups and downs, particularly with the morphing of MAPS Public Benefit Corporation into Lycos. I feel like it's kind of become more of that profit-driven pharma model, and I'm not so sure I see that same heart there anymore, although I'm hopeful.
What do you see as your role, or what do you want for the evolving psychedelic space?
Yeah, well, I would like psychedelics to be available to anybody that needs them, really. This is a step beyond decriminalization, and that's something I hear people mention a lot, like, "Oh, well, like, you gotta support our decriminalization efforts." But that doesn't help people like me or clinicians. Decriminalization, they're still technically illegal, and I, as a clinician, can't administer them to clients unless they are actually legal, and so they need to be legalized. And so I would like to see the substances legalized with modest regulations, not ridiculous level of regulation, but not so available that, kids can get them out of vending machines either. So, something reasonable, maybe like, I feel like if it grows out of the ground, it should just be legal. You should just be able to go buy it like you would buy any supplement at the store. And if it's made in a lab, then you should be able to get it, with a prescription, with some, basic quality control. But I don't think it should be any harder than that. And I don't think that anybody should be profiteering on these substances. And I think that's the biggest problem is as soon as you have something that's kind of new and maybe works even a little bit, big pharma wants to profiteer on it, which, I mean, it's a multi-level problem given that it takes 20 years to bring a drug to market. So that's a big investment. And I can understand pharma wants to get that back, but there's got to be a better way than, shaking people up for, hundreds of dollars for even just a single dose of ketamine, right? Which is practically free if you get the generic.
I really admire all the work that you're doing to promote and fight for equity, inclusion, and accessibility of these substances for all different kinds of folks. Everyone, anyone who needs them. And again, they're not for everybody, but for those who want or need them. Yeah, I'm so grateful that you're doing the work that you're doing.
No, thank you.
Yeah.
Thank you. Yeah,
Yeah.
I hope it's making a difference. Sometimes it feels a bit like, I don't know, David and Goliath. There's a lot of large forces out there that, have their own agenda, and it's hard to turn the ship in another direction. But, I'm going to do what I can in my little sphere of influence to help as many people as I can.
Monica, as we wrap up our conversation today, just coming back to your own experiences and your own tendernesses, I'm curious from that place, do you have any advice that you would give people who might be thinking about using psychedelics or going down this healing exploration with them?
Yeah, I think it's really important people understand too. It's not just the substance, but it's many things that go into the healing properties. It's also, the guide or facilitator or clinician that you're working with and your relationship with them, how much you trust them, and also how skilled they are, as well as the environment that it takes place in, and your own state of mind. So I think, yeah, so all of those things are important considerations. You have to make space in your life to do the work if you want to get the most out of it. So I think that would be my words on that. I think it's too easy to just, and I think we do this a lot in through our Western lens, is we just look at it as a drug or a molecule or an active ingredient, and it's so much more than that. It's a lot of different things that come together to make it work. So say keep that in mind.
Yes, a good piece of advice. Is there anything that you'd like to share as we close the conversation today?
Well, I guess, even though most of these substances are, not yet legal, there are legal options for people who are interested. I have a clinic in Ottawa and in Connecticut where we do offer ketamine assisted therapy. And I think sometimes people think because ketamine is legal that maybe it's not as good as the other psychedelics. And I think that's a misconception because, we've had really good results with the ketamine. And certainly if I had access to MDMA, I'd be using that. But I can't really tell you that I've seen that, that the ketamine isn't working as well as the MDMA in terms of outcomes. So we see excellent outcomes with it. And then there's also a number of legal opportunities overseas at different kinds of retreats. And it's a mixed bag. Some of them are not good. And, you want to make sure you go to a good one, but some of them are really good and people get a lot out of those too. So I would, encourage people to look into those options if they're interested in trying it and they haven't before. And of course there's underground options too. I can't recommend that as a clinician. It's a mixed bag. There's underground people who are fantastic, and then there's others that, should be in jail. So you have to be super cautious. But anyway, yeah, I guess that's all for today.
That's fair. And I mean, my small plug, being in community as part of navigating and finding the thing that works for you is always a good
Yeah.
idea, in my opinion.
Yeah. Yeah. Community is great. And that's where you can go and learn so much more about these things. And I know you have an educational network, which is fantastic here in Ottawa. So thank you for your work there and other communities, have other places people can go and learn more, and I encourage people to make use of those.
Yeah, that's lovely. Monica, thank you so much for sharing your story and for all the work that you do in the psychedelic space in support of, again, access, healing, and equity, and making sure that these experiences are available to everyone who wants them. So thank you for sharing your story.
You're welcome.
Mm.